I met a patient last year in January. He'd been in hospital with acute pulmonary edema. He had chemotherapy-induced cardiomyopathy, so he was quite an unwell man. I got to meet him and his family, and we connected on a really personal level, and I was involved with him for almost a year. I was able to help the family and him through that entire journey, right through from every hospital admission right through to when he went to hospice. So you do really get to be part of the family, and I know that I had a big impact on his life, and he's had a really big impact on mine.
Having that connection with people at all time is really important. I decided to work here because my dad had passed away in the palliative care unit just over 4 years ago, and I thought what a wonderful place it was, and I wanted to sort of just give back the amazing job that they did for my dad. His passing was, if you can say wonderful, that's what I would say.
I think for me, respect is the foundation that we need to, as each individual, build our relationships and our partnerships on. West Moreton Health, because we provide, a lot of diverse services to a lot of multicultural groups, we need to be able to show that respect for everybody. So in terms of showing respect, I think one really great strategy that West Moreton is actually employing within our health services, our elders, Ipswich Elders Circle. So Kerry, our CE's made the commitment to meet with the elders and to talk to them about the health service, about strategies, about direction, and getting feedback and getting endorsement for things that we want to do around Aboriginal and Torres Strait Islander health, and getting that feedback as well from the community.
Respecting our patients with privacy and dignity, and maintaining their confidentiality. I think that means respect for me, and also respecting one another, the staff, no matter whether they are the student nurses or grad nurses or the fellow staff members. So respect is all about listening to each other and respecting their respecting what they say. We do actually talk to patients about when they are leaving, about how they feel about cared for while being in our organization. So we do get a feedback survey from them, both in written or verbal, and they have given remarkable comments about how well the patients are cared for. It's not just about a patient care, it is more about patient-centered care.
To excel is to be your best, but not for you, to be your best for your job and to be your best for everyone else around you. It's about that support, setting standards, and actually bringing people together to be able to achieve the outcome that you've set out to do in the first place, and achieve that outcome so that it can be used and spread across not just West Moreton, not just the state, but the world.
I would define excel where someone in the health system steps up above and beyond what their general role is. So someone who does that little bit more, cares a little bit more, listens a little bit harder, inquires a little bit longer, those kind of things, and who are willing to think outside of the box.